Hi. Hola. Buenas noches. Good evening, everyone, and welcome to Hispanic Heritage Month Shop Talk, a beauty salon owner's perspective on health. Yo soy Cynthia Cifuentes. I am Cynthia Cifuentes, and I am honored to be here as Vice President of Marketing, Communications, Community Health Engagement here at Kaiser Permanente of the Mid-Atlantic States. I am here in partnership with my Senior Director of Community Health, Andrea McIntyre Hall, as well as our Mid-Atlantic Permanente Medical Group colleague, Dr. Mona Gugunia, who has been instrumental in supporting community health initiatives such as Good Health and Great Hair, as well as GoVax. Historically, barbershops and salons all over America have been known as safe spaces for both Latinx and Black communities, and we are excited to hear from our trusted partner salon owner, Dina Tillman, as she gives her perspective. As a Latina woman myself, I remember fondly growing up with my mother in a place we call La Peluqueria, which otherwise means the hair salon. And it was a place that I would call home. I would see my friends, my primas, my cousins, as well as a place of trusted relationships where my parents would actually get referrals to things such as the dentist, the dentista, the insurance, auto insurance, as well as the best swap meets to shop at, as well as doctors and healthcare. It's trusted social circles like these that matter in communities, and what we say and who says it matters the most. At Kaiser Permanente, we take racial equity and health equity very, very seriously, including how we treat our patients with culturally competent care, how we work with our communities to really support health outcomes. And it's all founded in terms of how we hire with diverse equity and diverse hiring practices, support, and how we advance our employees through business resource groups, which we call BRGs, and how we engage and support our communities in where they live, where they work, where they play, and where they pray. Kaiser Permanente has made substantial investments to address pressing issues such as health and social needs, access to economic security, food insecurities for all of our members, as well as our communities. I would like to highlight some of the work we at Kaiser Permanente have done and what are we continuing to do, such as major investments that our community health team has made, which demonstrates our commitment to supporting the communities we serve. We partner with many organizations across the country to support entrepreneurs of color and start in terms of how they start and grow their businesses. We also support people with all levels of qualifications to access to good quality jobs, support with young people with mentorship and scholarships to achieve academically and advance their careers. And we also support access to safe and fair financial product services to help them save what they can, borrow what they need to, and build wealth for the long term. This includes the support that we provide to the National Association of Latino Community Asset Builders, the Hispanic Scholarship Fund, and the Latino Economic Development Center, and so much more. KP has also made a commitment to support communities over time as part of the place-based strategy to strengthen areas that residents identified as being crucial to their overall well-being, and also aligns with Kaiser Permanente's mission. Two of these place-based strategies, one in Riverdale along the future Purple Line corridor in Prince George's County, and one in Bailey's Crossroads Colmar community in Northern Virginia. They're both areas that have large Latino populations, and we are working together with our residents, with our community, with our neighborhood councils to address their priorities of affordable housing, culturally relevant and healthy food access, as well as access to care. Finally, through our charitable care and coverage, we are able to provide coverage at low cost to the communities that need it the most. Members have access to preventative care, medication, care management, and more at Kaiser Permanente facilities. Kaiser Permanente's total investment for the charitable healthcare and coverage portfolio is $32 million nationwide. The CHAP and Kids program total membership is 11,000 across Maryland and Virginia, of which 90% identify as Spanish speaking. At this time, I would like to introduce my Senior Director of Community Health, Andrea McIntyre Hall. Andrea is one of our newest leaders here in the Mid-Atlantic region and leads our community health team and hails from Northern Virginia. She brings over 30 years of experience in community-based practices. And we also have Dr. Mona Cahunia, who was instrumental at implementing the vaccination rollout. Mona also leads equity, inclusion, and diversity team for the medical group, which aims to encourage and engage physicians and staff to deliver the most equitable care and inclusive care. I want to thank our community health teams and Dr. Mona Cahunia for your shared leadership during our GoVax initiative, and for continuing to collaborate with our community to offer capacity building trainings to our network, as well as our community partners across the region. And now I'm going to pass it to Andrea McIntyre Hall to share a little bit about our history of good health, great care. So please join me in giving Andrea a warm welcome.
Thank you very much, Cynthia. I appreciate that. Again, I am Andrea McIntyre Hall, Senior Director of Community Health here at Kaiser Permanente. Barbershops and beauty salons have a long history that goes beyond haircuts and shaves. These shops serve as gathering places for communities of color, where personal bonds are forged and barbers and stylists become trusted friends and leaders. And at Kaiser Permanente, we believe in total health, addressing the physical, mental, and social needs of our members, as well as the needs of the greater community in which our members live, learn, work, play, and pray. Our total health approach is a cornerstone of Kaiser Permanente's integrated delivery care system. The Good Health and Great Hair Barbershop and Salon Outreach Program is an award-winning example of total health in action. And our program addresses physical health through clinical screenings at barbershops and salons in Baltimore City, mental health with community conversations and referrals, and social health by offering important support services to participants that most need them. In 2016, Kaiser Permanente, we launched this program as a pilot outreach initiative centered around barbershops, equipping owners to help their clients live healthier lives. And the Good Health and Great Hair Initiative, it puts a critical health and social impact services in community barbershops and salons in neighborhoods where that support is needed most. It also improves access to immunizations and screenings for high blood pressure, diabetes, and other chronic diseases that disproportionately affect African American and Latino communities. The initiative also offers residents mental health conversations, wellness and fitness sessions, financial counseling, and workforce support, and so much more. In 2021, we had the benefit of being able to utilize this Good Health, Great Hair infrastructure to support the GoVax initiative in Maryland. And Kaiser Permanente partnered with the state of Maryland for that campaign to build confidence and vaccine acceptance in high-risk populations in communities in Baltimore City, Prince George's County, and Montgomery County. The comprehensive strategy included 75 partners that served as trusted messengers, capacity building training by Kaiser Permanente physicians, broad-scale messaging, and culturally relevant media outlets reaching more than 60,000 Marylanders. In 2020, we began the process of transitioning the Good Health, Great Hair initiative into a community health outreach strategy, which includes clinical and social supports that are offered across the region. So that is the history from pilot to program to pivot. And now I'd like to talk about Ms. Dina Tillman, the owner of Hello Bonita Salon, has been a partner of Good Health and Great Hair since 2019. And she truly epitomizes that term, trusted partner, by continuing to show her enthusiasm for this program. She hosts clinical events at her salon. She participates in panel discussions on COVID-19, mental health, and has been featured as a spokesperson for GoVax. She is a community advocate, and she spends her time organizing donation drives, collaborating with Pigtown Community Association, and raising her two beautiful daughters. And Dina, well, let's say, is a proud Puerto Rican and a strong advocate for the Hispanic population. She is dedicated to creating opportunities for her Hispanic neighbors to access quality health care and resources to support their health and well-being. Dina is owner of Hello Bonita, a full-service hair salon in West Baltimore's vibrant neighborhood of Pigtown. She is a Redken certified hair colorist with over 16 years of experience in the industry. And it was after many years that she had managed large beauty departments and salons that she finally decided to take that leap of faith and start her own business. Dedicated to providing that wow experience, Dina truly thrives in making her clients feel like they are the most beautiful, supreme versions of themselves. And she is deemed the salon's official motto as, if you don't look good, we don't look good, as spoken by the great hairstylist Vidal Sassoon. Dina aims to build a strong, empowered community, not only through establishing a lasting, loyal clientele of her own, but also through advocating for new, up-and-coming creative stylists. And Dina hopes that her efforts in creating an innovating and engaging atmosphere can help generate the kind of entrepreneurial spirit where successful people build more successful people. And now I would like to turn it over to Dr. Mona Gahunya to begin our shop talk.
Thank you. I'm just trying. Okay, perfect. Thank you so much, Andrea. Really appreciate that. And I know everybody's excited to hear from Dina, so I'll keep my remarks short. Just want to acknowledge that amazing things happen when leaders from community health and equity, inclusion, and diversity come together. And that's what happened with Good Hair, good health, great hair. I always want to reverse that because I'm a doctor, but it's good health, great hair. I have to remember that. And with GoVax, we came together, we got creative. We were able to engage our trusted and respected community partners and leaders. And I think it's just the beginning of amazing things to come. And Dina is one of those leaders that has been phenomenal to work with. And so I have the best job tonight because I get to speak with Dina, ask her questions, and really we get to hear from her for the rest of the night about her knowledge and expertise in this area. Before we jump into that, I wanted to just thank a couple of my MapMG colleagues, Dr. Eddie Bullock, Dr. Tanisha Cheatham, and Dr. Michael Horberg for making all of this work possible. It couldn't be done without them, their dedication and their leadership. And logistically, I wanted to go over two things. We have actually two different audiences joining us tonight. One is from Zoom, and those folks on Zoom can put any questions that they have for Dina in the Q&A, and we'll be trying to monitor those throughout the talk. And then the other audience is on Facebook Live, and you could leave your comments or questions in the Facebook Live comments or chat, and we'll be monitoring those as well. So with that, I invite Dina to join me here, and we will get started. And just to kind of get us started on a lighter note and to engage our two audiences, I have a question for the audience, actually, which you can type in the chat if you will. And feel free to also introduce yourself in the chat so we know who's listening and who we're engaging with. So like I said, on a lighter note, what are you more likely to cancel? A doctor's appointment or a hair appointment? And be honest about it. I won't be offended, I promise. And so while they're answering that, Dina, I'm going to turn it over to you. So that was a wonderful bio and introduction, but do you mind actually telling us a little bit about yourself and just sort of adding to what Andrea said?
My name is Dina Rodriguez Tillman, and I grew up my younger years in Puerto Rico in a community that was underserved, definitely underserved. Um, I was able to, I mean, in general, just have everything that we have in the education through community. My grandmother sewed everyone's clothes and made uniforms, and with that she would make our clothes, so everyone knew each other, and it was just a very tight-knit community. So I'm very grateful to just to be Puerto Rican and just to be here, and thank you.
Awesome. I think seeing some of the comments come through, and I think you win this one, Dina. People are more likely to cancel their doctor's appointment. It doesn't totally surprise me, but
it's funny because today my client said, "Oh my God, I was so grateful that your appointment is on Tuesday and not Wednesday, because I would have had to cancel my doctor's appointment today to make my hair appointment."
So I think that leads perfectly into our next question, which is actually a quote from Andre Leon Talley. And he says, "Beauty is health and health is beauty." To what degree do you agree with that statement?
All of it. I agree with all of it. Everything you put into your body comes out. Our skin is our largest organ. And, if you eat well, you're less likely to have acne issues, control a lot of, hormones that may retain water. Just everything that you put in your body comes out. So eating well is important.
Awesome. And can you tell us about your personal experience as a Latina in the healthcare system? And, we'd love to hear, I know that I speak for my physician colleagues on the call. We would just love to hear your perspective on navigating the healthcare system, both good and bad.
This is a deep one, because last year in October I got really sick. I woke up and I had issues with my vision in my right eye, and so I called the doctor, and they were able to get me in that same day. She told me, "Oh no, it just seems like you have some inflammation. You might have scratched your eye. You'll be fine. I'm going to give you these drops." And so then she said, "Just make sure you're fine. As long as it doesn't happen with your other eye, we're not worried about it. These things happen." So then about 2 weeks later, I couldn't open my left eye. And it started happening with my left eye. And, she continued to treat me, and she was really concerned. So she sent me down for a whole bunch of blood tests and didn't find anything. And that's when it kind of hit a brick wall. As soon as their test didn't find what they thought it should be, it didn't really continue. I kept on taking the drops. It was like treating the symptom, but not really finding me an answer. So eventually I went to a rheumatologist, and I was told I had carpal tunnel. Like, nobody was taking it very seriously. And so, I was concerned. I still don't have any definitive answers, but at that point, after weeks and months of going to the doctor, and I started trying to find alternative ways. And then I came across a holistic doctor who told me to get on an anti-inflammatory diet, because at the time I was completely vegan, and everything I was eating was, inducing more inflammation. So I went on the diet, and my vision started coming back. I never got any definitive answers, but after trying to advocate for yourself and telling people, well, I never feel well. I always have body aches and pains. And well, you do hair and you stand a lot, and you're going to have carpal tunnel. So if it's me and I'm following up and I'm young and I speak perfect English, what about the people who don't speak perfect English, who are elderly and don't have it in them to continue to go back because they don't want to complain? right? You know, well, you came back 2 weeks ago and we didn't find anything and your test didn't find anything, but I still woke up and couldn't see. So there was definitely an issue there. So, you know, yes, we tell people to be their own advocates and they'll keep on showing up, but at some point they just, you know, kind of lose faith in the providers and start trying to figure out alternatives, or some people just live with their conditions and stop going back because of the idea that, you know, I'm being looked at as somebody who's a complainer. They can't find it, so it's not really happening, but it definitely was happening. And so, you know, as a doctor, I think sometimes it's more than just treating the symptoms. You got to dig deeper.
Yeah. Thanks for sharing that. That was, I know, a lot for you to share. So really appreciate that. And I'm really taking it to heart as a doctor. And I was just seeing patients yesterday and thinking about what you said. And yeah, I mean, I think there's truly an art to medicine beyond the science. Sometimes we don't have all the answers and we don't have an exact diagnosis. But I think what your point is just like listening to the patient, really trying to understand their perspective, what's going on with them, and just reassuring them that you're going to be with them through the journey probably goes a really long way, even when we don't have a definitive answer.
Absolutely.
Yeah. Okay. And I don't see yet any questions from the audience, so I'll keep going with some questions here. Can you tell us, shifting gears a little bit, can you tell us a little bit about your clients and your business, and then how you've connected that to this work? Good health, great hair. Yeah.
So I'm fortunate enough to have a large demographic. It doesn't matter if your hair is textured, curly, coarse, or fine, whatever, any ethnicity. I get everything through my door. Everyone can get their hair done. And that's not always the case with a lot of women of color. They can't just walk into every salon. That's not an option. So for me, it is an option. Anybody can sit in my chair and they will leave with gorgeous hair.
That's a great philosophy, you know. And so when you're engaging your clients, how do you even begin a conversation about health with them?
Well, for hairstylists, the first thing we do is, you know, we ask our client if we can look at their scalp. So we're always looking. I've had a few clients where I've found sometimes moles, sometimes like a lot of dandruff, which can be concerning sometimes depending on the person. A lot of people don't even realize like their food allergies affect what they should be using on their heads and their skin. So if they have like a nut allergy and they're using something with nuts in the shampoo, it's going to definitely affect their skin. And then a big question is always about hair loss and hair growth. Every woman asks. It's just all the time, even men. I think men are more self-conscious about it than women. And so, you know, I always ask the question, well, are you on any medications? You know, for the most part, what I found was most Black women and Latina women who tend to have hair loss and sit in my chair have high blood pressure, and they're taking blood pressure medications. And those medications affect their hair growth and affect whether or not their hair is shedding. So I advise them to speak to their doctor to see if they can take, you know, any kind of vitamins to up their protein dose. And also, you know, we do things very holistically in the Caribbean. So like hair masks, we do like mayonnaise, and we do the eggs, and we do all the healthy stuff that you can do at home. And then we try to, at least I try to advise them to do those things. But a big part is definitely a lot of people are on medication. They don't really, I don't know if they're reading and researching about what the medication does. And a lot of it with blood pressure is hair loss.
Okay. Yeah, I think it's really sometimes hard to balance because, you know, controlling blood pressure is so critical to prevent strokes and heart disease. So you have to balance all the different things. But yeah, I mean, certainly having a conversation with their doctors and, like you said, taking other supplements that can prevent it is critical. We actually have our first question from the audience. Not sure which audience, but I'll say it may be Facebook Live or Zoom. But the question is, what have you learned from your clients that they are most reluctant to see a doctor for?
So many things. Some people are afraid to go to the doctors just, you know, for mammograms. You know, there's a fear there. They don't like it. It's uncomfortable. And that's a conversation with women, right? And men don't understand, but you know, you get that weight on you and you're just like, you don't like it. You don't want to go. Another one is blood pressure. Like we were discussing before, I don't think people take it seriously. I had a girlfriend who was in the salon during one of the events and they checked her blood pressure and it was through the roof, like close to stroke. And, you know, they actually followed up with her to ensure that she went to her doctor. There's so many conversations and so many things that we discuss when we're in the chair, from childbirth to, you know, how are you feeling, you know, postpartum. We discuss it all when we're in the salon.
Okay. Sorry, I'm trying to keep an eye on all the questions. And I think we have a few more coming in. But I want to move to a question I actually had for you, which is what is one, you kind of answered this a little bit at the beginning with your story, but if you could give one piece of advice to doctors or nurses who've joined today from KB Mid-Atlantic or elsewhere about healthcare right now and taking care of patients, what would it be?
Well, right now with the political climate and people's biased opinions, and some people don't even realize that they're holding biased opinions or stereotypes about others. You know, that's a hard place to be, especially when you're an immigrant and you may speak with an accent, and some people don't want to take the time to be present to hear you because you have an accent. So they don't lead with compassion a lot. They lead with annoyance because they don't understand you. And, you know, that's a big deal, because it doesn't matter whether or not you think you're speaking the same language, your body language is the same. Your attitude is the same. So when you're speaking with some type of annoyance or some type of hesitation to assist that person, then they're less likely to continue to speak. They'll go into their shell because they won't feel welcomed. And not just for the doctors. I mean, a lot of the doctors are compassionate. Sometimes it's just the person behind the counter, you know, when they're coming into the office. So, you know, the approach, making people feel welcomed and safe, especially, you know, knowing that you're probably the only person that they've spoken to about anything personal in weeks, months. You know, it's hard a lot of times to have real conversations with people outside of, oh, what do you do? Oh, that's great. How are your kids? That's great. Like, people don't dig that deep. So when you go to the doctor's office, you expect them to dig. You know, you want to come out your shell. You want to share what's going on, what your fears are, how you're feeling. And sometimes you don't get that chance because now you want to revert and kind of, you know, close yourself off because you don't feel comfortable.
Yeah. Well, thank you for that. You know, I think there's so much to what you just said, so much to unpack there. But one of the things that comes to mind is, I think as doctors or healthcare professionals, sometimes we forget how vulnerable people are when they come into our office, and how big of a step sometimes that is for someone, and then for them to open up and share with us. And then certainly actually what you said about accents and language barriers, it's something that we take really seriously, as an equity, inclusion, diversity team, and we're really trying to make sure all of our healthcare professionals are trained on being culturally humble and sensitive.
So a big part for the Latino community is also, we'll see that moms will go in with their children, and their children are their translators. And sometimes when children are speaking, one, we don't take it seriously, but two, their language for what's ailing somebody or what is the translation of what the mom is saying isn't always accurate. So, sometimes it's hard to dig when it's being verbalized as something minute, right? But the language is coming from a child. So that's a lot of things that I've seen. Also, being somebody who's Latino, whose first language was Spanish, and then coming here, my mom learning English, that's something that I realized is really big in our community.
Yeah, and that's we do see that as well. And sometimes the parents take a lot of pride in their children translating for them. So we have to be really careful when we say, can we also bring in a professional interpreter? Not to offend anyone, but just to make sure that we're getting the right, to your point, the right interpretation. So
Dr.
yeah.
Kahuna, I'm reading this statement. I recently read an article that patients are hesitant to discuss sexual orientation, gender identity. I could see that being huge in the Latino community, huge, just because, a lot of homes grew up very Catholic, and a lot of Bible beaters, and it's like it's almost made to feel like something's wrong with you, so they don't discuss gender. But hopefully with the younger generation and pushing for the Latinx community to really change the verbiage, change the understanding, and make everyone who is gay, queer, lesbian, bisexual, trans, just feel comfortable knowing that it is normal. You are accepted. And hopefully when anyone in the community is going to a doctor's office, that the staff and the doctor is sensitive to understand, like, not everybody who is trans or lesbian or gay, they might not fit your stereotype. You don't know who you're speaking to. They may just come in there not feeling 100% like themselves because they're not comfortable. So understanding that, building your office to help everyone feel comfortable, and maybe diversifying your staff to include somebody who is trans or, of the community would be important.
Yeah, we take all of that really, really seriously at Kaiser Permanente, and I'm proud to say we have an extremely diverse staff and physicians. And, one of the things that we talk about to our physicians and nurses and all of our staff with is really also asking the same questions of all patients, because you'd never want to assume where somebody's coming from or how they're identifying. So we really try to work on that, and there's always opportunities to do better, but something we take really seriously. So yeah, thank you for that. And I think there's a few other questions in there. Let me try to dig through. Let's see. Okay, here we go. So can you share about how your clients feel vulnerable when seeking medical services, and how you might encourage them, and how you might wish medical professionals would respond?
Well, just women in general, us seeking doctors out, GYNs, women health, that whole process is already an uncomfortable, situation, right? So, we do take referrals from each other. I'll ask my girlfriend if they have somebody really great. And that actually happened really recently because I was looking for a female doctor. I had previously had a male doctor. No offense to the males, but just saying, once you're reaching, I'm about to reach 45, I'm looking for comfort in a way that I can be vulnerable with my doctor, and share things that she may have gone through herself, So we talk to each other. We're like, who do you go to? Oh, do you like them? How long have you been there? Let me look at these Google reviews. We do all those things. But I do think it brings comfort to know that somebody that whether it's your hairstylist, the woman next to you, if she's been going to the same doctor 20 years, like, oh, okay, I'll look in. Do you think she's taking new clients, new patients? And it's like, yeah, check them out. And so I think that we do take referrals, and this is definitely a place where you would ask.
That's really, yeah. So that's interesting. It's so interesting to hear that perspective, but it makes complete sense. I mean, why wouldn't you be taking referrals and asking? And we do that for much lesser things that we like to go to a restaurant or whatever it is. So why wouldn't you do that for your doctor? It looks like another part of that question was if one of your clients is how would you advise them to speak with their doctors or share their vulnerability or their concerns with their doctors? How have you advised them in the past on that?
Well, when it came to the vaccines, which was a big topic, I was getting I've done my research. Well, what kind of research? Did you ask your doctor? Are they giving the vaccine? If they're not giving the vaccine, then come to the salon. We're going to have it on this date. And even if you don't get the vaccine that day, you can speak to a doctor or a nurse and get like the exact information that you're looking for. I think that was huge, to be able to just walk downstairs from your home or a block away, not have to have an appointment to really get the resources that you needed, but not just literature wise. Sometimes you want just literature, but then you walk in and there's a convenience, right, with having it right there, and you're already going to go to your hair appointment. But I think that the biggest advice for me is, well, one, are they accessible, right? Like sometimes we're waiting a month, 2 months out to get what we need, so big thing is, can you get in quickly? Like you might have to go in earlier, like call again. Like maybe it's the business owner in me, but when they say no, or they'll like say, oh no, we can't take you till this day, then I'll just keep on calling to see if somebody canceled, and advising my clients to do that as well. Like, if they say no, then you're not speaking to the right person. Keep on going, which is hard for some people, but it's definitely my personality trait. And then helping women feel comfortable to be able to speak up and use their own voices, to say, I really need to get in as soon as possible. If somebody cancels, call me. A lot of times people don't even know that's an option. They get in where they can fit in. So that's definitely been a topic of discussion.
Yeah. Another really great question that came in is, as you're talking to your clients about some of these sensitive issues and how to navigate the health system, do you think they're considering how they're going to teach the next generation, their children, about health services and health? And I mean, I know family is huge in a lot of communities, certainly in the Latino community. So
I think for us in the Latino community, I think our kids are at an advantage because they're learning how to be adults at such a younger age. like being a translator for something so vital, of their mother being sick, or their sibling being sick and their mother not being able to speak to what it is. So I know our community, our kids are growing up with the responsibility so much quicker than most, US kids. The conversation is a little different. The conversation is, I need your help. You have to help me be responsible for X, Y, and Z siblings, and having those roles, right? But then also learning how to navigate. And I don't think that most children are at the age of 8 or 9 or 10 having to translate for their parents and understand what that looks like, or sometimes even calling to make the appointment. That those are things that, at least for this community, are real, and it's teaching the kids how to maneuver a lot faster than most.
Yeah. That's an excellent point and insight. It just reminds me of a patient I saw last week, and working in Baltimore City, and she had brought her granddaughter to the visit, and I was fine with it, but of course, but she was like, my granddaughter comes to every single appointment with me, and her granddaughter didn't say anything during the visit, but she just sat there, and it was a lot for that child to hear everything that was going on in her grandmom's health, so really speaks to what you're saying.
I will
So
say, for me, I grew up with my grandmother, and now that I'm an adult, I understand what diabetes looks like. I never realized when I was a kid, her hands used to peel. Her skin would peel, and it was because of diabetes. And so we used to go to her doctor's visits. Like, that didn't click, but it did click as I got to a certain age. I was like, oh, so I'm prone to that too. And so understanding that and having to grow up so much quicker, I was that kid at those visits. So it's real.
yeah. So you started to talk a little bit about the COVID vaccine, and certainly wanted to make sure we got to that, because that was such a critical part of the work we've all done together over the last couple of years, and it continues to be, because these new boosters are actually so important for people to get ahead of any possible winter surge. They're the first time we have true protection against this Omicron strain. So can you tell us a little bit about how you've helped people overcome their hesitancy to get the COVID vaccine?
So, for me, it was really easy, because before COVID happened, I had already joined Good Health, Great Hair, and they were already giving flu vaccines. So prior to the COVID vaccine being released, people were really in fear. Okay, so if I get the flu, and then what if I get COVID? I want to get my flu shot. So if I do get sick, if it's the flu, it won't really affect me. I'll know it, and I'll be able to distinguish. There were so many reasons why. So people showed up and got their vaccine. Now, when the COVID vaccine came out, there were some people who were hesitant. They were seeing things on social media, and they weren't getting accurate information. And they would tell me things like, well, my cousin's mother, whatever, had a bad reaction, or, I got like so many stories, right? But at the end of the day, it's like, okay, well, if you really want some real information, the doctors and the nurses will be here. We'll be giving out the vaccines. We'll be giving out this one and that one, because at first it was going to be just Johnson & Johnson at first, and then that didn't happen. And then we ended up carrying all the vaccines, which was awesome, because then people who have really done their research had the option of just being able to choose. It's not like a one size fits all. Like, you can choose, you don't, if you're worried, here, pick what you like. So I think that was a big deal. I think that was definitely comforting to the community and people who did show up to get their vaccines and to be able to get the information. And it was convenient. it was convenient, you know. You don't have to hike down, wait in line, get an appointment. Just be here and we'll be here and we'll give you what you need.
Yeah. And obviously they trust you and they trust so many of your other partners in this work. And so that made, I think, a huge difference to have someone like you
Also,
endorsing it, you know.
I think that it was a big deal when kids were getting vaccinated as well. Like some parents were really hesitant. And I have 2 girls, and one of my girls has a heart condition, and they were like, "You're not worried?" And I was like, "I'm worried if she doesn't get it. You know, I got to send her to school. Like, we got to get this done." And so knowing that I love my kids and I'm willing to give them the vaccine, I think a lot of my clients were more open and willing to get their kids vaccinated.
Okay. So now the questions are pouring in, Dina. So you ready? Let me try to let me try to catch up here. Okay. All right. So the first one I have is you have such an important place in the community and get to see and speak to so many. In your opinion, what is the most serious threat to good health facing your community?
This is big in Baltimore. Food desert. People can't eat well, they're going to get sick. So I think that's a big thing facing our community.
Okay, I think I lost your audio a little bit just now, but let's see, did you change a setting? Can you try to say something else, Dina, so we can just
Can
make
you
sure?
hear me?
Oh, yeah, that's perfect.
Okay.
That's better. Yeah. Do you mind repeating your answer just because
Okay,
we
well, let
lost
me
you for a
make sure
little
I
bit?
answered that question correctly. You asked
Okay.
me the question again.
Okay. Yeah, sure. Let me grab that question again. So, so you have such an important place in the community with all the work that you're doing. But what do you see as the most serious threat to good health facing your community?
Food. Eating well. It's huge. Baltimore has a lot of food deserts. There's a lot of seniors that can't walk 2 miles with their shopping carts. You know, it's hard to be healthy when you can't get good food. Like when the Dollar General is literally your only grocery store. You know, now with gentrification, there's grocery stores that are popping up, but they're completely insanely expensive to a point where a senior citizen on a fixed income couldn't afford, I mean, a $12 bag of carrots. Like it's just unrealistic. So, you know, definitely the consumption of food and what they're eating is big.
Yeah.
So
Yeah, I hear that all the time in from my patients too. In fact, just yesterday I was talking with a patient who's diabetic and is still coming to terms with the fact that he's diabetic. He's young in his 30s and I don't think is fully sort of accepted it. And then we were talking through what he can do to, you know, either stay off medicine or come off of his medicine. And because that's what he, you know, that's what he was motivating him. And he was talking about, you know, what the reality of his lifestyle and the access to food that he has, and just asking really practical questions about like, well, what can I do in this situation? What should I eat? You know, and it's just,
that's why programs like Meals on Wheels are so important to our seniors, because that's probably the healthiest that they can eat. Yeah. You know, with the cost of living rising and they're on fixed incomes, they can't afford, you know, they definitely can't afford a lot of these grocery stores that are popping up. You know, the grocery store that is in their local area doesn't have a butcher and the produce looks horrendous. You wouldn't want to eat it. So, you know, all they have as an option is canned vegetables, which we know, you know, don't hold the same nutritional value.
Yeah. So we have a couple more questions we can hopefully get to. One is from the Facebook Live. So Dina, has your salon been elevated in the Latino community as a source of information and services? And do you act as a mentor for other Latina or Latino salon owners? Yeah.
So I've tried. I mean, during COVID, it's definitely been difficult for anybody looking at this call. I'm sure that they're probably having a hard time getting in with the hairstylist. A lot of hairstylists did not come back to work because there's no social distancing. I do have someone in my salon now who is working with me, and I'm mentoring her to be better at what she does so she can make the income that she would like to make and live the life that she wants to live, which is huge for hairstylists. You know, when we're not behind the chair, we don't make money. So it's important to us to be healthy, to be able to show up to work and be our best for our clients. What we really do, the way we make our money is by serving our community. So the person I have here now, she's not Latina, she's a beautiful Black woman, and I am, you know, helping her in whatever way I can to make sure that she is on the path to make the type of income that she would like to make.
Thank you. Okay, so another question from, I think, the Zoom audience. As a salon owner, how do you bridge the gap of trusting the healthcare system? What do you say to those people who may be mistrusting the healthcare system, and how do you handle misinformation? So there's a lot to that question, but you know, any part of it that you can take.
So the misinformation, I always say, are you sure you spoke to your doctor? You know, like, did you speak directly to your doctor? And then making sure that if they didn't get the answers that they're looking for, like I advise them to ask around, you know, look into a doctor, you know, talk, like even Walgreens, go to your local pharmacy, get the information you need. You know, the vaccines are there too. If you decide to get it, get it. If you don't, but at least you're informed, you know.
Great. Let's see here. With the Latino community, seems like a matter of trust. How do you make that connection? That's another question that came through. So I guess if we're just sort of to elaborate on that question, really, I think what it's trying to get at is the idea of trust.
So because I'm Latina, because I speak Spanish, and in the salon, you know, we do, you know, I play from Spanish to English, and it's definitely a community place. And I do post up that I have these clinics here. I think that, you know, people do trust me, and when they ask me questions, I give them direct answers. You know, I think it's a lot easier when you speak the same language.
That's great.
Mm-hmm.
I don't see any more questions coming in, so I'm going to ask you a question that I've been curious about. What has been the most rewarding moments or part of your work with Good Health, Great Hair and GoVax?
So I love the opportunity to serve my community in any way possible. So being able to have this space where people could come here and feel safe and know that they're welcomed is just amazing to me. I also think, you know, being able to provide services, right? Because what I've noticed about Baltimore is there's a lot of resource information, but not a lot of people giving out the resources. So to be a part of a program that actually serves not just the handouts, but actually serve the people. You know, we give them fresh fruits and vegetables. We give them their vaccines. They can come here and get their hair done. They can have mental health screenings. You know, that's vital and just amazing. And to be a part of that, to be able to, in a small way, be able to help facilitate that, just, it's amazing to me. And I'm just really grateful to be able to be in that role.
Yeah. Yeah, that's another insightful comment, Dina, is bringing the resources to the people, not just the information about the resources. That's a big difference, actually. I see it with a lot of my patients, and, you know, if they're trying to decide, you know, it's just, they have so many challenges. Some of my patients have so many challenges and difficult decisions to make. Unless you're really bringing those resources directly to them, they just may not get to it. They might not get to their COVID vaccine or their flu shot. So really critical.
I just think today, in today's economy right now, we have to remember that people are really choosing, can I have health care or gas in my car to get to work?
Yeah.
Like, how am I going to pay my rent? So if they are showing up to the doctor, how amazing is that? Because right now, a lot of people don't have the option.
Yeah. So great perspective that we all have to remember. And let me just double check to make sure there's no other questions. Wanted to, oh, I think there may be one. Let's see, I'm trying, there's a couple of long questions, so give me a moment here. Okay, well, so I think maybe we can end with this question. So the question is about patients who may have grown up outside of the US, in Latin America, and they're seeing a doctor, and sort of the cultural differences between seeing doctors in Latin America versus the US, and how have you had that situation come up with your clients, and how have you talked to them about that?
Ooh, that's deep. It depends on where they're from, right? So in some countries, they have socialized medicine, but even with socialized medicine, depending on where they're from, they're still having to barter, pay. I've heard, right? I haven't faced this firsthand, and I hadn't been to a doctor in Puerto Rico since I was a really young kid. I do remember going to the doctor, but I remember the doctor being more like a clinic at a school when I was a kid. They would show up and they would test all the kids and just give us, all the medical stuff. And then you went to the doctor occasionally if you broke something, right? Like you broke an arm, time to go. But from what I'm hearing is it's definitely different, depending on where you're from, if it's socialized or not. But the attention that you're getting is different. In some situations it's better, in some situations it's not. I definitely hear a lot about how expensive it is here to see a doctor, and I will say firsthand, it's outrageous. Even with paying almost $1,000 a month in insurance between me and my girls, if I'm going to a doctor's visit at a hospital, like it's $185 just because the doctor is in the hospital, even if it's not like an emergency visit. So understanding that, people are really facing challenges on making a decision of whether or not they're going to either go to the doctor.
Yeah. Again, a really important perspective. And I think for us who are in the healthcare profession, when we do have a patient in front of us, and just keeping in mind what it might have taken for them to get there that day, and really trying to address everything in that visit. And that's something that we do our best to do, but I think, this is really good perspective to help us always remember that and do better. I think we're sort of running low on time now. So did you have any closing comments, Dina, for everyone?
No, I just want to say if you really take into perspective how many times we are connected with each other, yes, the internet makes it easier, but really reflect on your time with yourself and your loved ones and your community, and take the time out for each other, make dinner plans at your home, invite people, make sure that they feel relevant and important in your lives, because right now, it's not just COVID, and vaccines, it's really mental health. And I think that we all need to connect with each other outside of the internet and outside of just the people at work. Like, we need to really connect with our friends and our loved ones, because mental health is really serious right now, and people need to feel grounded, rooted, loved, and seen. So take some time outside of the holidays, maybe like a weekend, have a Sunday dinner at your house and invite your friends and your loved ones that you haven't seen in weeks, because they could probably really need it.
Thank you, Dina. And I just want to say thank you for this wonderful dialogue and conversation. Every time I've met you or gotten a chance to speak with you, I've always left with some new learning, and tonight is really exceptional. So thank you so much for sharing your stories, insights, and your knowledge with all of us. And I will hand back off to my partner here, Andrea, to join us back on the screen for some closing comments.
Absolutely. Well, thank you, Dr. Kaluna, for your participation in this event. Appreciate your leadership. And Dina, you went far and wide and deep and talked about the quiet parts, and I am so appreciative of everything that you shared this evening, and how your lived experience shows up and how you advocate for yourself and your community. And on behalf of community health, we are grateful for what you have shared, and being able to provide some learning for us so that we can be better and do better. So thank you very much. And we appreciate everyone showing up this evening for this really rich conversation. And please visit kp.org to learn more about the wonderful work that we are doing in community health and our excellent physicians in NAPMG. Thank you. Appreciate it.
Good night.